As Minister of Mental Health and Addiction, I spend a lot of time listening. I listen to people in recovery, to families who've lost loved ones, to frontline workers seeing the same patients struggling with addiction, and to communities that are trying to balance compassion with safety. What I hear consistently is this: people don't want to be stuck. They want a way forward. And we know recovery is possible, and people deserve real opportunities to heal and to rebuild their lives. This belief is what's at the heart of what we call the Alberta Recovery Model. So over the past several years, Alberta's government has been building a stronger addiction and mental health system, one that's removing the barriers to treatment, expands recovery supports, and connects people to treatment and care instead of leaving them in crisis. Drug consumption services were introduced during a very different time, and it was meant to be as a short-term measure to an emergency crisis. Keeping someone alive in the moment that matters, but it cannot be where the journey ends. People need more than survival. They need hope. They need treatment, and they need a path to recovery and a better life. This is why it's time for Alberta to start transitioning, getting away from drug consumption services. It's not about walking away from some of our most vulnerable people. It's about doing better by them and using our health system more effectively. In Calgary, drug consumption services funding will be reinvested, and we're going to reinvest into expanded rapid access addiction medicine, what we call RAM, enhanced opioid dependency services right at the same clinic, at the OPD clinic at Schumer, and with additional on-site intake support by a registered nurse. We're also expanding medical detox capacity in Calgary and extended intake hours at the Renfrew Recovery Centre and 24/7 outreach response teams in the downtown area. In Lethbridge, we're going to support a new RAM clinic there as well, and 10 new medical withdrawal management beds, and 24/7 outreach response team. Now, these services will be based at the Lethbridge Wellness Shelter and delivered in partnership with the Blood Tribe Department of Health. In a moment, Carrie Bales from Recovery Alberta will speak in more detail about how these supports will work on the ground and how they're going to help people move forward. But I also want to be clear, this shift is also part of easing pressure across our healthcare system. When people are supported earlier, they're stabilized, and they're connected to treatment, they're less likely to end up in a hospital and the emergency rooms again and again. We know there are about 230 people here in Calgary that end up in an emergency room 10 or more times a year for drug overdose. They're very ill, and they need more than a drug consumption site. We can do better, and we're doing better. The Alberta Recovery Model is working. More than 150,000 Albertas were offered life-saving, changing connections to be needed for supports and programming last year alone. The award-winning virtual opioid dependency program is supporting a record number of clients. We've opened 274 recovery community beds that use the innovative therapeutic community model, and 370 more beds are going to open up this year. Right now, recovery communities, clients in both Calgary and Lethbridge are focused on whole person healing. I've met personally people in recovery communities who once felt written off. They were told recovery wasn't possible. But today, they're working, they're reconnecting with family, and giving back to their communities. We've also strengthened community outreach through partnerships with police and social supports, and all of this effort is making a difference. Since the peak in 2023, opioid overdose deaths have decreased by about 65% in Calgary and about 90% in Lethbridge. Regarding the Edmonton and Grand Prairie drug consumption service sites, we have no plans at this time to close those sites. At the epicenter of the opioid crisis in Alberta, Edmonton, unfortunately, will continue to be a top priority moving forward as we lean in even more, along with municipal and community partners. There's a lot of work to do still in Edmonton. Even with 2 drug consumption sites operating and significant investments made, Edmonton still accounts for about 60% of opioid deaths in Alberta each month. So we need to look closer at the data, including the data from 2 drug consumption sites. We need better insight into exactly what is happening in Edmonton and how we can best address the opioid crisis that community continues to experience. In Grande Prairie, we're going to reassess the future of the drug consumption site there as well, and more treatment capacity is going to come online, and that is going to include an opening a recovery community there as well. The positive news in Grande Prairie is that opioid-related overdose deaths have returned to pre-pandemic levels, just like every other municipality in Alberta, except Edmonton. So our government firmly believes people struggling with addiction deserve dignity, care, and a real chance to recover, but not to be left cycling through the crisis. Addiction is a healthcare issue, and the responsibility of our health system is to truly help people to heal and to get well. So I'll thank